The Glore Psychiatric Museum, established in 1968 by occupational therapist George Glore, is one of only a few psychiatric museums in the United States and is a community treasure in St. Joseph, Missouri. For nearly 5 decades, the Glore Psychiatric Museum has been dedicated to raising awareness of mental illness and shedding light on the stigmas associated with the treatment of the mentally ill. Before you begin your exploration of the museum, consider the following synopsis of the history of mental hospitals, formerly called asylums, and a brief history of treatment practices designed to help mentally ill patients over the years. The building of asylums in the United States began in 1844 and was influenced greatly by American activist Dorothea Dix. After conducting a statewide investigation on how the insane poor were cared for in her home state, Massachusetts, Ms. Dix reported to the state legislature, saying,
"I proceed, gentlemen, briefly to call your attention to the present state of insane persons confined within this commonwealth, in cages, stalls, pens, chained, naked, beaten with rods, and lashed into obedience."
As a result of Dix's efforts, a bill was passed to expand the state's mental hospital in Worcester, Massachusetts. It is said that over the following years, Dix traveled to many more states, including Missouri, spreading awareness and appealing to state legislatures on behalf of the mentally ill. During this time, another advocate for the mentally ill, physician Thomas Kirkbride, pioneered an architectural style that he believed would promote healing for the insane. This architectural style became known as the Kirkbride Plan. Kirkbride hospitals, large and oftentimes intimidating in presence, included long, extended wings intentionally staggered to allow sunlight and fresh air to flow into every room and floor. Kirkbride believed that sunlight and fresh air possessed valuable healing properties required for the successful treatment of patients. These asylums frequently included their own grounds and farmland that were commonly worked and maintained by the patients. Between 1848 and 1900, the work of both Dix and Kirkbride would influence the establishment of more than 40 mental hospitals throughout the United States. As part of the expansion effort, between 1847 and 1903, several Missouri state hospitals were built, most of which followed the Kirkbride Plan. After several years of construction, the first Missouri hospital for the mentally ill opened in 1851 in Fulton, Missouri. Today, it is known as the Fulton State Hospital. Fulton is the oldest public mental health facility west of the Mississippi and is the foremost maximum security treatment facility for mentally ill patients in Missouri. The second Missouri hospital was built in 1874 in St. Joseph, Missouri, and is currently the Northwest Psychiatric Rehabilitation Center. In 1889, the third facility, known as the State Lunatic Asylum No. 3, opened its doors to patients in Nevada, Missouri. Still in operation today, the Nevada facility is now called the Southwest Missouri Psychiatric Rehabilitation Center. In 1903, State Hospital No. 4 opened in Farmington, Missouri, but is known today as Southeast Missouri Mental Health. Treatment facilities were constructed all over the United States, and patients with mental illnesses were at last given a place where they could receive the care they needed with the hope that they might one day be reintroduced back into society. Unfortunately, just as the good intentions of advocates like Dix and Kirkbride began to yield positive outcomes nationwide, the state hospitals soon faced insurmountable challenges. These challenges would inadvertently influence treatment practices and further stigmatize mental illness. During the early 20th century, the United States faced war and extreme poverty, which left many government programs, including the state hospital system, in dire financial straits. In a span of roughly 30 years, World Wars I and II sharply impacted America's effort to treat those with mental illness. Priorities shifted, and nurses and physicians were compelled to apply their skills instead to the soldiers who were defending our country. In a sad twist of irony, both world wars, as well as the Great Depression of the 1930s, produced a new generation of mentally ill patients, many likely experiencing what is now identified by modern science as post-traumatic stress disorder, or PTSD.
The really oldest employees we used to have here that remembered those days would tell family members, bring the clothes you want them to be buried in because they're not going to leave. And so people would literally be 40, 50, 60 years in the institution because they weren't trusted to be on the outside and there wasn't really a way to fix their problem.
In these overcrowded, underfunded, and understaffed state hospitals, the situation became desperate. Extreme and experimental treatments were applied, often without patient consent. Treatments for mental illnesses, past and present, have been developed with the best of intentions to help patients recover. Limitations of scientific knowledge in every generation, as well as knowledge gained through continuous research, oftentimes lead to treatments being either modified for improved use or being discontinued entirely. Historical treatments may seem torturous or barbaric by our current standards and scientific knowledge, but we must remember that all were developed in their time for the purpose of helping patients.
They were struggling to find an answer. You know, they didn't want to lock people up for 50 years with no hope. They wanted to do what they could to help them. They truly thought that with the resources they had at the time, they were doing good. And some people did get better with some of the treatments, and a lot of people were harmed. The concern I have as a physician today is, you know, some of the medicines I give and some of the treatments I give have side effects, and I worry 50 years from now, is someone going to look back on that and say, oh gee, why were you doing this to people and harming people like this? But I certainly don't have that intention in my mind when I prescribe a medication for someone. So it's, you know, at the time, it was the best they could do.
Some of the most historically well-known and controversial treatments for mental illness include hydrotherapy, insulin therapy, electroshock therapy, use of restraints, and lobotomies. In the mid to late 20th century, more successful treatments were developed that are still used today, including counseling and therapy, as well as the use of psychopharmacology, or medications, used to control the symptoms of mental illness and reintroduce patients back into society.
And it wasn't until the 50s, 1950s, that they began to experiment with certain medications that seemed to bring back some of these chemicals into balance in the brain. And coincidentally, when that happened, some of these behaviors seemed to get better or to go away. And since that time, we've had a lot more science and a lot more technology to investigate what might be out of balance and where in the brain or the body the balance might be out of whack, and then how to set that right. And so as we come to the 21st century, we have a lot of medications that are fine-tuned to target some of these symptoms at the cause, not treating the symptom itself, but treating what might be wrong in the brain that leads to the symptom.
In recent decades, occupational therapy has also become popular in the United States as a means of helping patients learn new skills and channel their energies into productive causes. In fact, the Glore Psychiatric Museum is the result of one such program. In 1968, George Glore's patients worked together in their occupational therapy program to develop the museum's first exhibits. These exhibits remain in the museum to this day. As we conclude this introduction to mental hospitals and historical treatment practices, we recognize that throughout history, societal factors and limitations in research have greatly impacted patient care, treatment practices, and perceptions of mental illness.
People have, unfortunately in some cases, drifted from what used to be a mental institution to the jails and prisons. Some of the biggest mental health providers in the country are jails and prisons. And the theory was going to be, we're going to take these folks, put them into the community, and downsize these 1,000-bed hospitals, and the money we're going to save doing that, we're going to put into outpatient clinics and therapists, and we're going to treat folks in their home communities and in their own settings. To a certain degree, that was a very good plan. But unfortunately, for a number of reasons, it hadn't worked out as good as people would have hoped.
Breakthroughs in scientific discovery happen every day, but the reality is that our knowledge of mental illness and its causes are still very limited. We are faced with an uncomfortable question to ourselves and each other. What kind of care would you expect to receive as a mentally ill patient in today's society?
Unfortunately, stigma still is at work in mental health to this day. So the average person who maybe doesn't have the opportunity to come to a museum like this and see how far we've come with treating these problems may not see the need to spend money on these kind of things. Those folks, to their mind, are out of sight, out of mind. Somebody else is dealing with them. It's not my family member. I think that's starting to come around, that people are starting to see that if you neglect mental health, it's just as difficult as if you neglect physical health, and the health of a society is important to the individual members.
As citizens of this nation and world, it is our responsibility to ponder current treatment of the mentally ill and ask whether or not we are doing all we can to help them.